My name is James Simkins, and I'm Director of Information Technology Planning at Baptist Healthcare. And Baptist Healthcare is a not-for-profit healthcare system in Northwest Florida, and our mission is to help people throughout their life's journey. We are a mission-based organization focused on the health and welfare of our community in Northwest Florida. My role in the Information Technology Division is to help drive technology planning activities and manage the project management office. Healthcare is going through a number of radical changes. COVID certainly impacted a number of healthcare organizations and really just accelerated the need for digital transformation. And so we are no different. Since OnePlan, we've gone through a number of major system changes. OnePlan has really assisted us, giving us the tools and capabilities to help plan, track, and report on major initiatives that are seeing us through. Really, the challenges that OnePlan helped us address was keeping track of just the work that's happening. What are the major initiatives that we are pursuing, and where do they stand? And what we have also been able to do now is, rather than just have a list of projects and then separate lists of who's doing what work or relying solely on our vendors to manage schedules, we can manage that capability in-house. So that gives us much more visibility and capability to be proactive with how we're proceeding. Our journey to really look at how we can modernize tracking our work was to look at a number of different solutions. So when we moved on from our old SharePoint simple list and keeping track of tasks manually, we looked at a number of vendors. And at the same time, we were looking at a PPM solution, or project and portfolio management solution. We were actually in talks with Microsoft, and we were migrating from Lotus Notes, believe it or not, to Microsoft 365. And so we identified a number of vendors and solutions, and we, in the end, looked at about, I think, 5 to 6 different solutions. And Microsoft actually introduced us to OnePlan as one of the solutions that leverages their products that we should be considering. So after Microsoft introduced us to OnePlan, we added that to the list of vendors we were considering. And where OnePlan stood out was value. Again, I want to reiterate, we are a not-for-profit, community-based organization. And so we need to pursue value and get value out of any investments we make. And so we wanted to make sure that we got a solution that delivered a lot of capability, but didn't necessarily break the bank. Also, the integration with the Microsoft technologies we were just about to start implementing was very beneficial. That allowed us to eliminate any potential overlaps and redundancies that other solutions were going to be bringing forward. And in the end, it was a good team, and it was a highly configurable solution. And so between value and capability, OnePlan came out the winner. But what we have been able to do is deliver a clear viewpoint of where we stand on the key initiatives we are tracking. And we've been able to provide those capabilities for reporting and insight to our team members within the groups that are deploying technologies, but also to report that to our leaders in our organization. One example where OnePlan added a capability that we did need was time reporting for large projects where we want to capitalize labor. So with a very large ERP replacement initiative that lasted over 1.5 years, we were able to use that functionality and helped us meet our budgetary expectations. Since the implementation, it's insight and reportability. And we have been able to more systematically track not only work, but also items or issues and risks that may be affecting our work. So that has allowed us to provide more clarity in tracking as well. As everybody knows, in healthcare, we're constantly under threat. And we've had organizations, both to the east and west of us, in nearby cities, being taken down for multiple days. So our organization is very vigilant and very concerned with IT security. And when it comes to SOC 2 reports and IT security, those are critical items we review for any technology that's going to be acquired by Baptist Healthcare. And so fortunately, OnePlan met our needs at the time through acquisition. We've only seen the level of their security increase with time. Well, I'll say the OnePlan team, very approachable from the start, and it's been good to see so many of the same faces and names who were around during the sales cycle to where I am right now 4 years later, and really 5 years later. And so it's a good group. You can communicate from the CEO to the product director, and everybody's a family. It's been really positive. We're focused again on results, and we're pleased that OnePlan has given us the tools to get to where we need to be. Abilities have evolved over time, and that's served us well. And in terms of further growth, obviously the nature of project work is evolving. What's considered a project is changing. What's considered teamwork and task management is rapidly changing and getting consumerized. So we would hope that the organization and OnePlan continues to evolve the product to stay aligned with those project trends. So success ultimately comes down to how well we serve the community, because that is core to anything we do at Baptist Healthcare. But from my perspective, success is making sure that we are helping our teams know where they should be focusing their time and letting everybody know how we stand with getting work done. And the more that we can easily track and the more that we can show progress and help people find and resolve any barriers along the way, that's simple success.